Good morning, everyone. Welcome to today's meeting of the Safe, Vibrant, and Healthy Community Committee. We have two items on the agenda today, both related to our homeless community. One is our white flag efforts, and the other is a hotel update for permanent supportive housing emergency shelter. So we will start with the white flag effort. Turn it over to Larry.
So good morning, everybody. It's good to see everybody on this beautiful day. So again, white flag is an issue recently because of COVID. And again, having to have that physical separation to the extent possible in that shelter setting. White flag is just simply a designation when the temperatures are at a certain level that everyone is welcome in the existing shelters. That being said, we have been able to stand up white flag very successfully. Everyone who has needed shelter has been provided shelter, even being able to stay on during the daytime when it's cold outside, and also some warming stations. So again, we do have Kim Crawford here this morning with the partnership to speak more about how we have approached the white flag locally in the era of COVID. So Kim, are you there?
Larry, just to clarify something, part of the issue is because of COVID, there's fewer beds available at the Wake County shelter.
That is correct.
Okay. Do we have the number of beds that we started with pre-COVID and where we are now?
Kim has those figures, yes.
Okay, thank you. Hi, Kim.
Hi there. Thanks everyone for having me. I do have a quick, what I think is a simple presentation for white flag. So I'm hopeful that this will work. So can you see my screen?
Yes.
Yes, perfect. Okay. So again, the white flag is technically the NC 507 severe weather white flag. And this is the information specific to this year. So the inclement weather that we're talking about are weather conditions like rain, wind, and high and low temperatures. Typically what we think about when we think about white flag, we think about cold temperatures. But just a quick little caveat, white flag conditions do present themselves when the temperature is very warm as well, above 100 degrees. The homeless people that are experiencing homelessness are a very vulnerable population in terms of health. And so we do need to recognize the need for a severe weather white flag program. With that being said, exactly as Larry had indicated, for our particular COC, when the temperature drops below 35 or lower is when our COC declares white flag. There are a number of resources that we could use for reviewing the weather, but for consistency, the COC has picked the Weather Channel, weather.com, using the zip code 27605. That is the site that we use when the agreed upon site that we use when we are declaring white flag. White flag information can be found on the Wake COC website and also St. John's website for specifics regarding white flag. So exactly to your point, Mayor Baldwin, typically, how does white flag work? And white flag worked dramatically different pre-COVID as it does today. Prior to COVID, whenever we were declaring white flag, our homeless shelters within our continuum of care all pitched in for white flag. The temperature, the declaration would be made, and literally our shelters put out a white flag and they open their doors to anybody that is in need of warm, safe space. Prior to COVID, we had 619, on March of 2020, we had 619 beds. I used the plus there because that means that when there's white flag, our shelters would open up their space. they might put cots down in the common area or in the kitchen area, but they were able to add space, and all of our shelters could do that on their own. After White Flag, things and life in the homeless crisis response system dramatically changed. No longer were our shelters able to simply put out a white flag, because they were in the middle of reducing the number of beds that they have available. Because of COVID, they had to focus on physical and social distancing the number of beds. So since COVID, we've dropped from 619 beds to today, we have 402. So we have a 200 bed drop in our continuum of care for no other reason than the physical distancing. You'll notice that there's no plus after the 400 because there is zero space for White Flag. That was the call, that was the mission last year and this year as well. So what does that mean? Last August, we started searching for a location. Last year, we used Southeast Raleigh Table. This year, our primary shelter is St. John's Metropolitan Community Church. They were designated specifically for singles, both men and women. The Salvation Army is for families. And then we have Overflow Shelter. We have Healing Transitions, was originally intended to be for women only, but they have since November 13th, the first day that we declared White Flag, been an overflow for both single men and women. South Wilmington only came on last week as Overflow Shelter. So Mayor Baldwin, to your question, when White Flag started in November, the South Wilmington Men's Shelter had 142 beds. On December 28th, they reduced their shelter capacity by 30 beds. So they dropped 30 beds out of the continuum of care. What that did was throw 30 more potential clients in South Wilmington out onto the street, which is why St. John's Metropolitan Community Church is full on every single night. We also have an emergency day warming center. We didn't originally have this, but since January 16th, the day of the snow, sleet, ice, we've been able to utilize First Presbyterian has a location that they allow Church in the Woods to use on the weekends, on Saturday and Sunday. What First Presbyterian has allowed us to do, that if there is a day when the temperature does not go above 35, we can use that space as a day warming space. So those are the locations. A couple of things to keep in mind when we were looking at the criteria for White Flag. We were specifically looking for one place. Now, everything did fall in line when we had the extra 30 beds over at South Wilmington. But it's easier if you have one single location. We do know that there have been, for example, a number of congregations that have been willing at times to step in and be a space for White Flag. It's on their terms. So if they, which is difficult for us when we declare White Flag, because we don't know what day of the week we are going to be declaring White Flag. If a congregation has a pre-planned event on Monday night, but the temperature drops, then they can't open and they don't open. Another one was, what if we got 7 congregations to help? That's great too. However, put yourself in the mindset of someone who is unhoused, unsheltered. They're already stressed. They're already facing a number of traumas, and then they've got to remember which congregation to go to. So the idea has always been one single location large enough to meet the need. We have a larger need this year than we did last year. All things staying the same. Because we are bottlenecked within the homeless crisis response system, there's no place for people to go. Our inflow is much, much faster than our outflow. The month of December, we housed only 11 households. But yet we have over 1,500 referrals in our system right now for people looking to even get into the system. A couple of other things that we looked at, preferably on a bus route. Shelters run their own program. So the program itself, specific to the guidelines for the emergency shelter, white flag emergency shelter policies and procedures, we allow the shelters to run their programs. That's what they do. We allow them to run it on their own. For white flag, we are specific though. We need them to open at 5 p.m. and close at 8. If they want to open before that or close after 8, that's their call. For white flag for the COC, the minimum is open at 5 and close at 8. Families are not split up. Any family makeup, regardless of what that is, if they have children, they can go to Salvation Army. Salvation Army will take any family makeup as long as they have children. At St. John's, if they have the space, they will keep a couple together. And they have been able to do that consistently throughout the white flag season. So families are not split up. To split a family up is a violation of fair access. And we have been successfully able to work very diligently within our homeless crisis response and Larry's team as far as adherence to fair access. With that being said, we have been very, very busy. We have declared since November 13th, 57 days of white flag. We have used 5,200 total beds. That's not the unduplicated. We have served 744 unique individuals. So it has been busy and it has been full. Primarily, the largest demographic is men, which did and does pose a problem when the number of beds are reduced at the men's shelter. Thankfully, Healing Transition has been able to help us out, and South Wilmington, again, within the last week, has been able to come online and act as Overflow. But as you can see, we've been very busy. After next week, though, fingers crossed, we believe that the number of days that we are declaring become less and less. We declared Friday, Saturday, and Sunday of this week, and we will not need to declare again until right now, Sunday night. But it does look like Sunday through Thursday of next week. And then long range forecasts look to be much better. White flag will close on April 1st. That is generally, after April 1st, we generally do not see any temperatures drop below 35. So we are anticipating a November to April 1st white flag season, cold weather white flag season. So with that, does anybody have any questions specific to white flag?
So, Kim, one thing I have a question about, and that has to do with our day shelters. I know at one point Love Wins ran a day shelter near Oakwood in one of the churches there. What did they?
They are no longer.
Okay, so we don't have a day shelter anymore then?
No, we do not, and that is critical. We do have Oak City Cares, so don't get me wrong. I mean, we do have some place for people to go. However, Oak City Cares is a day service center. So it's not like your standard drop-in center where anybody can go and drop in to get out of the elements and or seek services. So we need an Oak City Cares-like facility that has no constraints. Ideally, if we could get a day center a little bit farther north so that we have the at least north and south of the city covered, and have it also have enough space where we could also have it be a drop-in night shelter, that would be ideal. We do want a day center where we can have access to, showers, laundry, but services as well. Workforce, healthcare, computers, all of those kinds of things as well. But no, as of today, we don't have your typical standard drop-in site.
Mm-hmm. Yeah, Oak City Cares is more of a social, how do I put this? Provide social services and human
Correct.
services. Yeah. All right. I'm going to ask Larry a question. Larry, has the county or anybody been in conversations about a day shelter?
Yes, we have. And what we have suggested is that we kind of follow the process that we used in locating the existing Oak City Cares and to come up with a list of criteria that we would need to guide that search in terms of the square footage that would be required. Are there basically doing the kind of programming that we did with Ratio Architects and then looking at what might be available for purchase or lease in the community. We've also had conversations with the county about whether this would be a county owned and operated facility or it would be a nonprofit owned and operated facility, and those questions still haven't been answered. But we have made it clear that the shelter functions really do primarily live with the county, that the city is not in the business of operating shelters.
Okay. Does anybody have any additional questions about White Flag? So one thing like Kim, I've been pretty actively involved in this. One thing I would like to see is us being more proactive when we're looking at this. We know it's been an issue for the past 2 years. Can we start looking at this now for next year? And I think that would be really helpful.
Mm-hmm.
And then one other thing I've heard too, and Councilmember Cox can attest to this, there's the encampment near 540. And I guess my question is, what services do we have for North Raleigh? Everything is kind of focused downtown. Is there anything accessible for others?
So the encampment on 540, I can say is frequently visited by our street outreach providers. So our street outreach teams are out there on a regular basis, a couple of times a week. I can tell you that the biggest issue with our street outreach providers is they walk in and they it is going back and forth on an ongoing basis to build a relationship. The thing that hamstrings them is there's no services. There's a 4-week wait to get into shelter. So even if someone was at the 540 encampment, they can't get in right away. So it isn't that they're not getting on the list. They certainly do enroll them. But our system is bogged down. And until we can get movement through the system, there's not a lot of places for people to go. And since we have the reduction in the number of beds, and I don't anticipate that we'll get back up to over 600, in the near future, if ever. So our encampments are being visited, to be sure. And we do have another meeting with our street outreach work group this afternoon at 2:00. So we are meeting with them again as far as that goes. There is a lot of work with the 540 and all of the other encampments. So the difficulty is when spring comes and the leaves come up, the conversation will stop for a while, and that's when we really need to buckle down and see if we can do something. When when people don't see it, it's not a hot topic. Right now you can see it. So same thing happened last year. So, but we are, rest assured, our street outreach teams, all of them are out there on a regular basis.
Okay, yeah, I think what you just said, Kim, is accurate. You know, it's like people will stop, and we've got to keep on this. So, Councilmember Cox, you had a question?
Well, yeah, this goes back to the number of beds. I mean, you know, I really appreciate the nonprofits taking the lead and working with encampments, not just at 540, but throughout the city. And but where is Wake County? And all? I mean, we understand the city does not do shelters. The county does. So where is the county in terms of stepping up and providing more beds? And what can we do to support that? I mean, what are the concrete solutions and steps that we can take to get more beds? And I mean, do we need to provide more funding to the county? Does the county need to raise taxes in order to do it? I mean, what are the solutions?
Well, Councilman Cox, I will say the county runs one shelter.
Mm-hmm.
All of the other shelters are provided by our nonprofits within the community. So they run one shelter. So certainly we are confined right now by staff and space because of COVID. And this applies to White Flag as well. My staff have even gone to help staff White Flag. And my staff and even at the partnership, we have had to consolidate a bit when a COVID outbreak runs through the White Flag, because then they can't come back and work at their regular day job. And our staff in all of our shelters, they are overwhelmed. They are overwhelmed, and man, they're doing an exceptional job with the space that we have. But right now, Councilman Cox, it's space constraints and staffing constraints.
And in order to address those constraints, is it that you just need more money?
Well, certainly money is at the root of finding new locations and then staffing up. I mean, we do need additional sites. We do need skilled nonprofits going in and running those locations, or having one of our nonprofits staff up to meet that need. I do think that more shelter is not necessarily the answer. We do need more beds. So small yes for shelter, big yes for the addresses on the other side. We need movement through the system. And so we need addresses for people. We need places for people to go.
Okay, so how do we involve the county in order to address this need?
Well, the county is involved in the homeless continuum of care conversation, to be sure. So the homeless continuum of care meets regularly, and they do have a seat on the continuum of care governing board, as the city does. And so the conversations are happening ongoing, and certainly they did have their expansion bridge to housing expansion program that they funded 4.2 or 4.7 million, but none of that was shelter. Well, some of it was shelter. Don't get me wrong there, but it's not new shelter. It's not new space. It's expanding some of the programs that we have.
Okay, so you're saying small shelters. I mean, you're not really expecting expansion of shelters, but you need more beds. But you're saying also at the same time that we're not expanding beds because of COVID. So I guess the question is, how can we expand the beds within the existing shelters?
We can't within the physical constraints we have right now. We can't add more beds. We can at South Wilmington Street.
Mm-hmm.
They have capacity for 240. They dropped down to 140 once COVID hit, and now they're down to about 114. So they can expand. Our largest demographic of people experiencing homelessness right now is single men. That does not mean that we don't necessarily need more space. We have a tremendous number of unhoused, unsheltered people right now. When I say small shelter, I mean that yes, we need to focus on shelter to get people out of the elements. The biggest need is for people to go. So they need apartments, houses, duplexes. They need places to go. We can get them into the homeless crisis response system, but we can't move them out. Because there's, again, like I said, we housed 11 households in December, 11. We need to double that, triple that to get movement through the system.
Okay. Okay, so what you're really talking about is more permanent housing.
We do need more permanent housing. Yes, yes, sir.
So if we had more permanent housing, then we can move people into and out of shelters faster.
Correct. The goal is to have the length of time homeless as short as possible, from beginning to experiencing homelessness to the time they move into permanent housing. The goal is 30 days or less.
Okay.
We're over 112 days right now.
And have you been seeing this problem increasing in terms of numbers over the past few years? I mean, obviously, as the region has grown in population, are you seeing a similar increase in the growth in homelessness?
Yes, absolutely, because there isn't a place for them to go. It's fantastic that our area is growing, and that is fantastic. It's not for the low to no income, it's not growing at the same pace.
Mm-hmm.
So right now we have landlords, just like our realtors are facing, these exorbitant bids for houses. Our landlords are now facing the same opportunity where people are actually bidding on apartments so that they have a place to go. That makes it very difficult for our homeless service providers who need apartments or other units at or below fair market rent.
Okay. Thank you.
Mm-hmm.
Larry, I think bringing back to the county some of the issues that were raised would be helpful. Councilmember Fort, you have a question?
Really quick. Thanks for the presentation, Kim. I remember you did a presentation or something last year, and you indicated that there were a certain number of doors or units that were necessary to, I guess, technically end homelessness or something along those lines. I don't remember what that number was last year, but do you know how many units we need today is my question.
We need about 2,000 right now, and then we need turnover to help keep that moving.
Okay. All right. Thank you.
Mm-hmm.
Okay. Any other questions? Okay. Thank you, Kim, for being with us today. I think I've said this before, when we funded and opened Oak City Cares, everybody thought, yay, we're done. No, that was the beginning. And so much work still needs to be done. I just don't want this issue to kind of fall off the radar. It needs to be front and center, no matter if we're talking white flag or white flag with heat. So thank you for being here. And Larry, thank you and your team for the work that you do in this area. Okay. Next, we will get an update on the hotel that we purchased.
Yes. So again, we purchased the hotel in September. Essentially, we bought a pretty much fully occupied extended stay hotel. This is providing housing of last resort to well over 100 individuals that are living there now. The hotel has remained pretty full for the past few months. Very, very stable occupancy. I am pleased to report that we are finalizing an agreement with CASA to be the nonprofit operator of the facility. CASA has been around since 1992. They own and manage several hundred affordable rental units. Permanent supportive housing is kind of something that is a specialty to them. So for many of their residents, they do provide various types of services. So we anticipate, again, CASA being on board and basically shadowing the existing property manager through the month of March, such that CASA is poised to take over management when the current lease ends again on March 24th. So in the meantime, some other things we've been working on. We're working with Spectrum to upgrade the internet and phone services at the site. We have an architect on board who is helping us with enhanced fire alarm notification system. We are also working with the architect for permanently closing the pool that is on the site and creating an outdoor amenity area. Once CASA is on board, we will kind of jointly work with them and with the architect to come up with room renovation prototypes. So as we do have turnover in those units, that we're poised to go in and do makeovers very quickly. CASA recommends trying to batch it and do 4 rooms at the time. So again, CASA will be providing services to excuse me, existing residents. And the plan is that as we have turnover, is to bring in permanent supportive housing residents that CASA would provide supportive services to as well. It would be a mixed population. We'll still have extended stay residents and mixed in with some permanent supportive housing residents. Are there any questions about the update?
Larry, how many, I know you said this, but how many people are we currently housing there? What's the capacity?
Right now we have 8 vacant rooms that are offline for improvements. So we've got 105 that are occupied right now. And again, average length of stay is 2 years. We have some people, one person there that's been there for 15 years. So I mean, this is home for people. So,
Larry, we had this discussion before too, when we started the Compassion Fund. Remember that? That was to try and help people get out of shelters, paying their first month's rent and their deposits. And then when COVID hit, we were trying to figure out how do we keep people in hotels, not wanting to see them evicted and contributing more to the problem and the challenges. So I guess my question is, do we know why most of the people are there? Are they there because they can't afford first month's, last month's rent? Are they there because of medical or social issues? I guess what I'm asking is, have we done an analysis and can we figure out how we can best help them?
we haven't done an analysis yet. My educated guess would be that most of the people there are there because of eviction histories or poor credit histories. But that's something that CASA will be doing, working with those existing residents. So if they do need, if all they lack is, the first month's rent and the deposits, that we can work with them to help them get out into the conventional rental market. So it's focusing not only on the incoming permanent supportive housing tenants, but helping those existing residents further stabilize as well.
Does anybody have any questions? Councilmember Cox?
Yeah, I would like to also see that analysis as well of not only, why they're in these shelters and why they're not able to find more permanent housing, but also an analysis of what we can do in partnership with the county and nonprofits to ensure that they have a path forward. Is it a combination of education and training? Do we have to go to the legislature and have some conversation with the legislature about regarding bad credit histories or perhaps criminal records? So the question is, what are the options going forward, and to be able to provide them a path out of poverty?
Well, for these folks, they're lucky because CASA is going to be taking on that role of working with those existing guests to determine, what are those barriers to their participating in the conventional rental market. It is not cheap to live out there. It's over $1,000 a month. So, I mean, it's not a lack of income. It's a host of other factors. And again, I think in most instances, it's going to be that credit history or that eviction history that is going to be the barrier.
Well, that's an interesting point you raise about the cost of living there. And is there something that we can do about that to reduce that cost, provided they put the money aside for deposits for living elsewhere?
We are going to be adjusting the rents across the board. That's a part of working with CASA. We're already pretty close to being at the fair market rent, but we're going to transition into fair market rent levels by September, I think is the planned time frame now.
And is there any opportunity for us to take that income and help fund, like build our compassion fund, for example, to help pay for those deposits into more permanent housing?
That's something we can look at.
Okay. Yeah, I would encourage it. Thank you.
Larry, do we know what this is going to cost us each year to operate and maintain?
Well, that's the beauty of this operating model, is because we are relying on the income stream from the extended stay units to cover the management and operating costs associated with what would be the permanent supportive housing units. If we were getting no rent at all from a permanent supportive housing tenant, the income, again, from the extended stay rooms is covering all the operating costs. And in the case of CASA, also funding the supportive services. So it's a wholly contained model. So it's self-sustaining. And that's the thing that some people find innovative, that they've never seen this type of operating model before. So if properly managed, we won't have to subsidize it.
That's awesome. Okay. Any, Councilmember Buffkin?
Thank you, Mayor. So I've been taking this in and reflecting on our previous meetings on this topic, and all of this is very important work. The hotel, the White Flag operation in an incredibly challenging time. But I'm struck that these are tactics for dealing with problems, and what strikes me is there's something missing. And the thing that I think is missing is planning and coordination on a strategic level. And I think we can do it. And I've seen other communities do it. And what I mean do it is make a commitment to end chronic homelessness. I think that's within a goal that's within reach. And I'd like to see this committee recommend to the council that we get started on that with a scope of work start identifying funding sources and make that happen. It's a worthy goal, and it's a goal that we can achieve in a prosperous community. So I'd like to see us take some action today to get started on a plan to end chronic homelessness in Raleigh.
That actually is the role of the partnership, is to end and prevent homelessness. And also, what I would ask is, how do we work in partnership with the county who leads us in these efforts to put more emphasis on this? Larry, that's for you. Easy question.
Easy question. Well, let's not forget the $8 million we just committed to CASA for the Kings Ridge. And that includes housing for people right now who are in hotels or who have been chronically homeless. So that's 100 units there. We are working with HRNA to update our affordable housing improvement plan. That is a part of their scope of work, is looking more broadly at what we are doing to address this issue. And there will be opportunities for them to interact with council as they work on updating that plan. But the county needs to be there with us, yes.
Councilmember Buffkin?
Yeah, they're again, great tactics for dealing with the problem, but it sounds like nobody's in charge and nobody's taking ownership of this problem. So, if I need to make a formal motion to get this started, I'm ready to do that. We've got to have a plan. And right now, everything I'm hearing is we don't have a plan. We're doing lots of stuff, but we don't have a plan. And we need to get started on that. That's the first step. And then we need to implement a plan. And we need to achieve that goal of ending chronic homelessness in Raleigh.
Why don't we do this? Why don't we ask the county to come speak to us on this issue? Councilmember Cox?
Yeah, I agree. I would rather hold this in committee and have some further conversations with the county, and maybe staff can come back as we have these conversations with a framework for a strategy that we could then recommend to the full council.
That would be what I would prefer to do, and have the county come back and speak to us. And let's go from there.
Well, for clarity, when you say someone from the county, are we talking about staff from the county? Are we talking about someone from the county manager's office? Are we talking about one of the county commissioners? How do you want to proceed in terms of getting the county's input or being able to ask the county questions?
How about all of the above? Somebody from the county manager's office, somebody from the housing department, and also let's invite one of our county commissioners who chairs their Housing and Human Services Committee. That way we can all hear the same thing.
Do you know who that is?
I do not.
Okay, we can find out.
Okay.
Yeah, I support that idea.
Okay. Councilmember Buffkin, you okay with that approach?
Well, it sounds like weak tea to me. More talking and no movement toward a concrete plan. It's kind of disappointing, but if that's where the committee is, that's where we are.
Councilmember Fort?
I'm listening to the dialogue sort of go back and forth, and a part of me is wondering if it wouldn't be more beneficial to ask the city managers to set it up as a work session, just so that full council can hear it, and if there's some action to be taken, maybe that expedites the process. But that's just a thought that I had.
Councilmember Cox?
I think this preparatory approach would be good and then could then serve as input to a work session for the full council. I mean, how does that sound as a compromise?
So,
Yeah, any of it's fine with me. I was just sort of throwing that out there.
ask them to come back in a work session. Larry?
Want us to ask the county manager's office and an elected official and someone from the housing to come back in a work session? Or come back to this committee first?
Well, I'm trying to figure that out with with the group. Councilmember Cox?
I would support either approach. I just thought that maybe coming back to the committee might be easier.
All right, let's do this. Let's come back to the committee first, and then we'll go from there. All right?
At your next meeting then, if possible?
Yes. Yes. All right.
Mayor, I just want to share, we can certainly make that our goal. I'll just keep you and the committee abreast if there are any logistical challenges or scheduling conflicts that would prevent us from being able to arrange that at the next meeting, but that we will make that our goal if that's the committee's desire.
Yes, please. And if we need to change the date of our committee meeting, we can do that to accommodate schedules.
Certainly. Thank you.
Okay. All right, everybody. Thank you for being with us today. Very complex and challenging issues. I appreciate everybody's time and commitment. So thank you and see everybody soon. Meeting is adjourned.